We're coming to you with breaking medical news. Could a diabetes drug be a game changer for weight loss? A new clinical trial is giving millions of Americans struggling with obesity hope. And it couldn't come at a better time because obesity is a significant risk factor for severe illness from COVID-19. So today, we're going straight to the source. Dr. Robert Kushner, an obesity researcher at Northwestern University, a good friend of mine. He actually ran this groundbreaking clinical trial. Dr. Kushner, thanks again for joining us.
Yeah, first of all, thanks for having me on. I don't use the word game changer very often. In fact, it's the first time I've used it in my 40 years of practice. This medication is 1.5 to 2 times more effective than any of the currently available medications on the market. Patients, on average, after 68 weeks, lost 15% of their body weight, and that turned out to be 34 pounds from starting weight. And more exciting, Dr. Oz, is that a third of the individuals in the study lost 20% of their body weight, which was about 46 pounds, which is really an amazing amount of weight loss.
Just to put this in context here, 33 pounds, right? That which was the average over the 17 months of the trial. Oh, you see this cinder block, everybody? Right? You haven't done construction recently, I can tell you this is pretty heavy, right? 33 pounds. Imagine losing this from around your waist. That is the amount of impact of a medication, which, again, I got to say, I was stunned by as well. I never anticipated those kinds of benefits.
And it's it mimics GLP-1, which is a gut hormone. Now, we've known about gut hormones for quite some time. Most of them increase your insulin response to sugar, and that's why they've been used quite a bit for diabetes. But at higher doses, they also affect one's sense of hunger or fullness. So when you eat a meal and you feel full, don't want to eat anymore, part of that is a release of gut hormones. GLP-1 is one of them. And not only does it slow your stomach from emptying, so it gives a sense of fullness, but even more importantly, it has receptors in the brain, which is the appetite centers in the brain, which has to do with hunger and fullness and thoughts of food and so on. So when the same drug, which is used for diabetes, is used at higher levels, the weight losing effect, the appetite controlling effect really kicks in. And that's why this drug is much more effective than a drug currently on the market, which is for diabetes.
Now, of course, there are no magic bullets when it comes to weight loss. And these trials and the participants in them made lifestyle modifications. It has to do with these special receptors found in many organs. Now, before you go to them, here's the stomach, the liver, the intestines. All these organs have to respond when you eat. So normally there are receptors on these that are activated after a meal, right? And every one of these has a role. And that increases the amount of insulin you make, which, as you know, is important to digestion. Now, let's go to the stomach. Right? It actually takes the stomach and it slows gastric emptying, which means the food stays in the stomach longer. The stomach distends, right? And guess what happens when your stomach is full, right? You feel full because that's what it's all about when you eat food. That's why you feel full. Now, these same receptors are also found in the brain, and they release this hormone that causes you to have a decrease in appetite. It's called GLP-1. The result? You feel less hungry, right? So you eat less food, which could lead to weight loss. That's the goal for so many folks.
Welcome back to CBS This Morning. We're learning more about the first weight loss drug approved by the FDA in 7 years. About 70% of American adults are overweight or obese. That's a lot of people, and this drug could transform the lives of those who qualify. Dr. John LaPook joins us now to discuss. I hope you brought your prescription pad.
I know you.
I'm telling you, a lot of people are very interested. I have a friend of mine who's on it who lost 15 pounds in 1 week.
What?
15 pounds in 1 week.
That's a lot in 1 week. A lot of that must have been water weight, but yeah.
Well, we'll take water weight.
we
will take water weight.
Wegovy is
He's trying to lose 70. So who qualifies for something like this?
So, Gail, because I've already been asked this by about half a dozen people,
Yeah.
It is not for the person who wants to lose 5 pounds, 8 pounds, all right?
What about 10, 15?
10, okay, so here's how you think about it. It's for people who are obese, a BMI of 30 or more. We'll talk about how you calculate BMI in a second. Or 27, overweight, 27 or more BMI with one weight-related medical condition like high blood pressure, things like that.
BMI is your body mass.
Body mass index. And for people out there, just Google BMI calculator. You put in your weight and your height, and you'll get a number.
And also brace yourself. You're probably overweight.
Well, that's
70% of Americans overweight or obese. Right. Including myself.
Over 40% of people over the age of 20 are obese. I mean, so
how does this work? What does it do?
So it works in a number of ways. One is it mimics a natural hormone that we have, and it decreases craving, decreases appetite, so it works in the brain. It works to slow stomach emptying, so you get full sooner. And then it enhances the release of insulin, and that helps.
I like this. So you have to get a weekly injection.
It's an injection.
So if you once you start it, do you have to stay on it? Can you take it for a while, get your desired effect, and then get off of it?
So in the studies, and I spoke to Dr. Rubino, who was one of the study authors, after 20 weeks, some people continued, and other people just went on placebo. The people who went on placebo gained back more than half of their weight. For some people, it gives them that little boost, and then they get going, they lose a little weight, and they're able to exercise.
Did people
more.
lose enough weight to improve their overall health?
Absolutely. Again, Dr. Rubino, who was very intimately involved, said that people decreased their circumference of their abdomen, they decreased their blood pressure, their sugar control improved. So, you know, I think we have to say this, there is a huge stigma about being obese.
Yes.
And people say, just snap out of it, it's willpower. For a lot of people, it's not willpower. It's set at a wrong level, and this is going to be great for those people who just can't do it, no matter all of their diet, all their exercise. They still can't lose the weight.
What about after you have a baby and you have extra weight? Ask your poor friend.
Give it a try. It's not known really during pregnancy about it. So that would be something that people should.
And still used in conjunction with diet and exercise.
Diet, yes, diet and exercise. We always say you got to do that.
Yes, but you do have to do that.
But it'll help.
There's no free lunch.
No. All right, Dr. John LaPook, thank you very much.
This summer, the FDA approved a brand new weight loss drug that's got everyone talking. But is this new weekly injection a true game changer? Let's take a look. Obesity has been linked to over 350,000 deaths a year, and more than 70% of Americans are considered overweight, and what's even more shocking, 1 out of 3 people are considered obese. But is there finally a cure to the battle of the bulge? The FDA recently approved a chronic weight management drug for the first time since 2014. The medication is injected under the skin, which mimics a hormone that targets the area of the brain to regulate appetite and food intake to feel full faster. According to the FDA, it seems to work. Over a 68-week clinical trial, 33% of patients lost more than 20% of their body weight. But this treatment isn't just for everyone. The FDA recommends it for obese patients, and it needs to be used in conjunction with a reduced calorie diet and increased physical activity. So, is this just another fat-finding fad, or is this new drug finally the answer to lose weight, once and for all? Joining us now via Zoom to help break down all the ins and outs is board-certified gastroenterologist, our friend and colleague, Dr. Sue Satcher. Welcome back to the show.
Thank you so much for having me. I must receive about 100 DMs a day regarding this new medication, and I think it is going to be a game changer.
Well, let's get right into it. Tell us more. So Doc, how exactly does it work, and how often should someone take it?
So it's considered a GLP-1 agonist, and what that does is it mimics a hormone our own bodies produce when we eat, and it tells us that we're full and to stop eating. But the problem is the one we make in our own body only lasts a couple of seconds, whereas this injection medication will last a whole week. So the FDA has approved it for anybody who is obese. And that means if your body mass index, which is a function of your height and your weight, is over 30, you're definitely a candidate. Now, there's still a lot of people who are in that overweight section. And if your body mass index is 27, which is considered overweight, but have high blood pressure, diabetes, high cholesterol, fatty liver, those people are a candidate too. And this is really going to be a game changer because it's the first medication that has been approved for long-term treatment. The trial was for 68 weeks, but it's the first weight loss medication that it's been approved basically for the rest of your life. But I like to tell patients there's no magic pill, there's no magic injection. So if they're not motivated, nothing is going to help them.
So true when it comes to obesity and weight loss, that yes, maybe there's a pill, there's something that helps, but it's still basically good old-fashioned diet and exercise are the keys. What about the side effects, any risks that people should be aware of?
So every medication has side effects and nothing is, 100% perfect. But nausea definitely and GI problems are the most common side effects associated with it. And, we got our fingers crossed. Obesity is the #1 health problem, not just nationwide, but worldwide.
So you actually are using it in your practice. You have patients that are using it so far. What is your response, your feeling about it?
So the response has been good.
Another question I have for you as the expert, why has it been 7 years since the FDA has approved a new weight loss drug after we just agreed that it's such a huge problem, we need more help there?
Well, I think that a lot of these stimulant type medications have caused side effects that they've had to stop, and the trials can be continued. So hopefully this will be a safe class that we can go moving forward.